all about ulcerative colitis. We don't always appreciate just how amazingly complex the human body is, performing countless invisible tasks every moment of the day to keep us well. But our bodies don't always behave the way we'd like them to. If you have what's called an autoimmune disorder, your body's defense system doesn't only guard against invaders, it attacks your own tissue too. Inflammatory bowel disease, or IBD, is one of the most well-known autoimmune disorders, but it's actually an umbrella term for a family of conditions, including Crohn's disease and ulcerative colitis, also known as UC. If you have UC, you're not alone. Millions of people around the world have it, including as many as 900,000 here in the United States. Despite how common it is, there's still a lot we have yet to learn. Even its causes aren't entirely known, but we do believe that a number of factors may play a role, including your genetics or family history. People with an immediate relative who have UC are more likely to have it themselves. Your environment, stress, diet, sleep habits, medications, physical activity levels, and even air pollution may all trigger flares. And your microbiome. The microbes in your intestines may be a big factor in your condition. What happens with UC is that your immune system attacks the linings of your body, particularly in your large intestine or colon. That lining becomes inflamed and produces ulcers or sores, along with a range of unpleasant symptoms. The most common of these include rectal bleeding or pus, diarrhea with blood, pus, or mucus, rectal pain, abdominal pain, the frequent need to empty your bowels, the frequent sense that you have to go even when you don't, unexpected weight loss, and loss of appetite, among others. But these aren't the only symptoms you might experience. It's also common to have symptoms outside of the digestive tract, including burning, redness, itching, and other problems of the eyes, mouth ulcers and sores, skin conditions, and joint conditions, including various types of arthritis, to name a few. If that sounds surprising, here's Dr. Erin Forster, a gastroenterologist and specialist in UC and related diseases, to explain why UC can be so wide-ranging.
We use the word mucosa to describe the lining of many parts of our body. The most obvious one is probably the guts, right? The lining of our mouth, the lining of our esophagus, stomach, and all the way down through our intestines. But we have kind of linings of other areas as well. So like our eyes are covered with a lining. Our joints have a certain lining that protect and keep certain spaces separate from one another. And so that's the reason why we share kind of inflammatory conditions between that. And if you think about the skin, it's the lining that covers our whole body.
While anyone can develop UC, it typically begins when you're younger, usually between the ages of 15 and 35. And since it can worsen over time, it's important you seek treatment as soon as you suspect there may be something wrong. So what signs should have you calling the doctor? Here's Dr. Forster again.
If someone notices that they're having abnormal weight loss, blood in their stool, mucus in their stool, if they're having a lot of cramping abdominal pain, or perhaps diarrhea or unusual constipation, that would be a departure of what they had been experiencing in months and years past. Sometimes that would be a good thing to bring to your primary care physician's attention, or if you're already under the care of a gastroenterologist, if there's a family history of someone close to you who has a history of ulcerative colitis or Crohn's disease, that can also be very helpful.
It's not always easy to break the ice with a subject like UC. Many people find it too embarrassing to discuss, but it's definitely a conversation worth having. Treatments today can be remarkably effective, but you can only take advantage of them when you've had a proper diagnosis.
We often do blood work and stool testing to start. We often combine this with cross-sectional imaging like a CT scan or an MRI, depending on patient-specific factors. And I am an endoscopist by trade, so oftentimes it will include a colonoscopy so we can get a direct visualization of what's happening on the inside, because sometimes the tests I've just mentioned don't give us 100% of the picture. And often that intestinal ultrasound can add another piece or layer to the puzzle. So it won't just be one straight test, like, for example, if you're having your blood pressure measured, but rather an aggregate if we put all of those pieces together to determine, does this seem like Crohn's, does it seem like ulcerative colitis, or does it seem like something else?
Armed with this information, your doctor can determine the specific form of UC that you're suffering from. It comes in a few varieties, and your particular condition will influence the treatment options available to you. No matter what form of UC you're dealing with, there's a good chance that your doctor will begin by suggesting lifestyle changes. Quitting smoking, reducing stressors in your life, taking up activities like meditation or yoga, increasing the amount of physical activity you're getting, and, most of all, examining your diet. The foods you eat may not be the cause of your UC, but they can certainly contribute to the symptoms you experience. Talk with your doctor about what dietary changes are worth considering to help address the frequency and severity of your flares. Beyond lifestyle changes, there are a number of medications available today which have been shown to be helpful in the treatment of UC too. Some of these have only been brought to market very recently, but they've been generating remarkable results for patients with even significant cases of UC. Medications today include immunosuppressants, biologics, aminosalicylates, small molecule medications, and antidiarrheals. Sometimes, unfortunately, even medication and lifestyle changes aren't enough. In the worst-case scenarios, there can be complications that aren't just uncomfortable, but that are actually life-threatening, including things like tears in the walls of the colon, uncontrolled bleeding, rapid swelling of the colon, and more. These aren't symptoms that can be left untreated. The risk of major infection, systemic shock, and worse is far too great. And in those cases, the only solution available is surgery. Surgery might involve what's called the J-pouch procedure, where the colon is removed and a pouch is created, connecting the remaining intestine with the anus and allowing you to eliminate as you normally would. In some cases, a more extensive procedure called a proctocolectomy may be required. Here, the colon, rectum, and sometimes the anus is removed, depending on your particular condition. The surgeon will then create a small opening in the abdomen called an ostomy, and a small bag will be fit over the opening to collect waste. While that doesn't sound particularly appealing, you can take comfort knowing that today's ostomy bags are comfortable, hygienic, and virtually unnoticeable. Living with UC may not be easy, but you don't have to go it alone. Reach out for help today. Develop a personalized care plan, and do your best to stay positive. By taking an active role right now, you'll be doing what you can to control your UC rather than having your UC control you.